So we're looking at safe medication management and polypharmacy. Safe medication management. You can manage medications, but you must do it safe. And I think we all consider safety first. We wear helmets on bicycles, helmets on, it's advised to wear a helmet on a motorbike, seatbelts. All of those things are centered around safety. So medication safety and polypharmacy. Polypharmacy is a term that is used to describe multiple medications. Patients take multiple medications for all kinds of things. More than one, more than two, more than 5 medications. People can be on medications for various reasons. I see another thing people come in now. So just to recap a little bit, we're talking about safe medication management, priority being safety. We drive our cars, we wear a seatbelt for safety. We cycle bicycles, we wear a helmet for safety. We ride motorbikes, the recommendation is that people wear a helmet, although because it's not law, some people don't wear it, but it is the recommendation for safety. So the same with taking medications, we have to think of safety. Polypharmacy is a term that's used for multiple medications. So when your doctor has prescribed multiple medications for you, we refer to it as polypharmacy. Somebody may be on a blood pressure pill, they could be on 2 blood pressure pills, or they may be on another additional pill so they don't hang on to water for too long. So a lot of older adults are on multiple medications for various reasons. I do want you to think of this patient, Miss Jenkins, a 78-year-old female with diabetes type 2, osteoarthritis, osteopenia. Osteoarthritis, as you know, is arthritis in the knees and the hips. We see these people having hip replacement, knee replacement. Osteopenia is what you can get before you get to osteoporosis. COPD and high blood pressure, which is not unusual for a woman of that age. Type 2 diabetes, some osteoarthritis, maybe high blood pressure, and COPD, especially if somebody was a prior smoker. When you're caring for older adults, either professionally or informal home caregivers, family members, medication treatment is an essential part of care. As we age, our bodies age. We see that on the outside. I didn't have these wrinkles when I was 20. Mind you, I didn't have this hair when I was 20 either, but you know, we go gray, we see it all on the outside of our bodies, but it also happens on the inside of our bodies. We're just not seeing that. Older adults are taking multiple medications, and their multiple medications are prescribed by different doctors. So you have your primary care doctor, or your GP, whatever you want to call them. Primary care doctor, I think is the term that's more familiar here in the United States. If you go to the kidney doctor, they may give you medication. If you go to the heart doctor, they might give you some more medication. And if you go to the diabetic doctor, they'll give you some medication. So now you have medications coming in from different doctors. The primary care doctor is very slow to adjust the medications that have come from the specialty. They will usually refer back to that specialist before they begin adjusting any of those medications. They certainly won't take you off them everything will go back through the heart doctor and the kidney doctor. So the heart doctor, the kidney doctor, and the diabetic doctor don't talk to each other. They talk to the primary care doctor. So if the primary care doctor is in the middle, and then you have all these specialties around them that will talk to the primary care doctor, but the specialties don't talk to each other. Very rarely, unless they know the specialist on a very kind of more personal basis. There's a little picture here of what looks like a blister pack, and I'll refer to that later when we talk more about the pharmacy. The statistics. This is just numbers. It's just so you have an idea of the kind of medications and people that are out there taking medications. So a survey of 2,200 US adults over 65, this was in 2010, 2011, it showed at least one prescription medication was used by 87% of people. There's 54.1 million people in the United States that are over 65. And at least one prescription medication is used by 87% of those people. The 2,200 adults is a sample size, which gives you an indication of what's going on in the population. 5 or more prescriptions were used by 36% of people, and 38% used over-the-counter medication. As you know, over-the-counter medications, you do not need a prescription for over-the-counter medication. They include your herbal and your dietary supplements. Just continuing with the statistics, herbal and dietary supplements have increased from 14% in 1998 to 67% in 2010. And remember, that was 22, right? That was 12 years ago. So that percentage has even increased more since. The cost of medications, we know, can be a burden, especially on older adults that are on a fixed income. And also this, I think we'll all agree, we see a lot more homeopathic and, health coaches and that sort of thing going around, right? And where they're buying, some people are buying supplements, they're buying herbals, they're not necessarily getting prescriptions filled. They're trying to fix it another way. One thing to mention about herbal supplements, they are over the counter, as you know, they are not regulated for. So the FDA does not regulate for herbal and dietary supplements. It's only prescription medications that the FDA regulates for. So while you can get them over the counter and they're not regulated by the FDA, that does not mean that they're harmless. I think sometimes people might have the perception that these supplements are harmless. They're not harmless. They can interact with prescription drugs that you're on. They can interact with food. They can interact the same way that prescription drugs will interact with food or with other drugs. There's two, I have an example. All these medications, usually now, when you go to the doctor's office, they will ask you, are you on any supplements? Are you on any herbal medication? Are you taking any? Don't think that you shouldn't be necessarily on, okay? But just let the doctor know what you're taking. Sometimes people say, oh no, I'm not on anything. I could be on a whole slew of stuff. So down the road told me that this worked for her, so now I'm taking it. And you might find it works. You just have to let your doctor know. And one of the reasons why you need to let your doctor know, this is just examples, okay? Ginkgo biloba extract. A lot of people were on that some years ago. They were taking it for energy. They were taking it for all kinds of reasons. You can see it on all the pharmacy shelves, in Walgreens, CVS, everywhere. If you're on the blood thinner warfarin, the other name for it is Coumadin. Ginkgo biloba can make your blood even thinner, and you're at a higher risk of bleeding. So if you fall, you may bleed. You might get a bleed in your head. You fall, you probably definitely bleed. So anybody that's on warfarin or Coumadin is usually going back to the hospital for blood tests. They go every few months. They may go every 3 or 4 months. And their blood test is to determine and measure the clotting factor in their blood. They don't want them to clot. They don't want them to develop clots, but nor do the doctors want them to have blood that's too thick. If you're taking ginkgo biloba, your levels are going to be off. Your levels are going to be a lot thinner than they need to be. If you haven't told the doctor, they may reduce your warmth, which it's not how it's supposed to be. Just be very aware that these medications, while they're over the counter, they're not harmless, especially if you're on other medications. The other one I want to mention is St. John's wort. St. John's wort, people I know have used it as a mood stabilizer. They've used it for various reasons. Depression, they're not feeling good, they feel low, etc. Oh, get some John's wort. John's wort will interact with some of the antidepressants. There's 3 classifications of antidepressants. One of the classifications that St. John's wort interacts with that we know of is, some of the SSRI antidepressants. And it can cause what is known as serotonin syndrome, where you have too much serotonin in your blood. You can get serotonin syndrome, and serotonin syndrome can be fatal. So this is a reason for when you go to your doctor. We're talking about safety today. We're talking about safe medication administration. So when you're going to your doctor, it's really important that you tell them everything that you're taking, including your herbal and your dietary supplements. There's multiple reasons why older people are impacted more by polypharmacy than say younger people are. Younger people, you don't see young people much on medication. Yes, there are some people that have specific conditions and they have to take medication. Older adults are at greater risk because of changes in the body that occur with age. We talked about the outside of our bodies, how that changes as we get older. The inside of our bodies changes as well. One of the organs that can change significantly is our kidneys. That's where you're going to be excreting drugs. If your kidneys aren't working as well as they were when you were younger, you're going to have slower elimination of drugs. They're not going to leave your body as quickly as they would before. The other thing that has been found is that polypharmacy is an independent risk factor for falls. You're on multiple medications, they can interact with each other. We talked already about the herbal supplement. Other medications that you're on, you're taking medications, you're maybe a bit unsteady, and you can very easily fall. Blood pressure medication, if you have high blood pressure, you have to be on blood pressure medication. That's not going to be. That you have, yes, you can do things with your diet, maybe to reduce your dose of medication, but that is not going to go away. You have to be on that blood pressure medication. One of the things with your blood pressure medication, when you sit down and you get up quickly, you can get what they call orthostatic hypotension. Okay, so that's sudden getting up and moving, you can get dizzy and fall at that time. So it's recommended for older people when they go to, whether you're on blood pressure medication or not, when you get up off the chair, you should take it slowly, because rising up can drop your blood pressure, and that's where you feel this. But definitely, when you're on high blood pressure medication, it can happen even more. We all know that if you fall, older people especially, fall and get a hip fracture, some people come back from that and others don't. Now, I'm talking about you break a hip. I'm not talking about an elective surgery where you plan with your orthopedic doctor to go in and have a hip replacement. It's not the same thing. The risk isn't the same, because when you're scheduled for surgery, they've explored all the risks and they know where what to look out for and everything during your surgery. Talking about compliance, the more medications you're on, the less likely you are to be compliant. You forget the medication, you forget to take it. You forget to take it in the morning and then you take it in the evening, or you forget about it completely that day and you think, oh, I forgot it yesterday. Some people, and don't ever do this, although I am giving it as an example. You forget to take your medication today, do not double your dose tomorrow. Don't ever double up your dose. You missed it, make a note of it, let your doctor know the next time you go there. Oh, I forgot at this stage. Just let them know. There's really no major harm, but you need to let them know. Do not double up on your dose because you forgot it at one time. If you have visual problems or if you have cognitive impairment, all these multiple medications can affect that. Complexity is also associated with non-adherence and non-compliance, okay? We're talking here about not taking not taking your medication first and then not taking it at the right time. Okay? There's your times and that are written on the prescription bottle. So this was the example I gave you at the beginning. For a hypothetical older female with chronic obstructive airway disease, COPD, type 2 diabetes. We're not talking about insulin here, we're talking about type 2. Osteoporosis, hypertension, osteoarthritis, the clinical practice guidelines for somebody with these diagnoses would recommend prescribing 12 medications. So those diagnoses would carry 12 medications with them at minimum. And I just a little input about clinical practice guidelines, and you may know this already. Clinical practice guidelines are guidelines that come out for nurse practitioners and for doctors so that they have the latest information on what to prescribe for different conditions and different diseases. Okay, they're guidelines that they go by, like if your doctor is 85 years of age and still practicing. It doesn't mean that he's practicing the same way as he did when he was 30 or when he was 40. The guidelines are coming out and they come out from they're emerging from research that's going on all the time. Side effects. I want to talk about the side effects. So every medication has a side effect. There is no medication that doesn't have a side effect. You're putting a composition of chemicals into your body. Every medication has a side effect. People of all ages can get side effects. Older people are more likely to have some of the side effects or more of the side effects. Remember, we talked about the kidneys as they age, the liver is aging as well, the heart is aging. All of these organs are aging inside the body that we don't see. We see our outer aging process. We don't see the inside. All right, there's two things to pharmacy. to medication. There's what the medication does to you, and there's what your body does when you receive that medication. So there's two aspects to it. I look different to all of you in the room. You all look different from each other. We all have different faces. We have different insides. Our organs behave differently. Our environment affects it. Our genetics affect that. So how we react to drugs, to medications, is different as well. So just because somebody is taking one medication and they've never had any side effects from it, doesn't mean that you're not going to have side effects. And usually, I'm sure this has happened to you, usually when a doctor will prescribe a new medication, almost always they'll ask you to come back in 2 weeks or 3 weeks or 4 weeks so that they can see that the medication is effective. If they don't ask you to come back for a follow-up appointment and you've been prescribed a new medication, ask them for that appointment. Ask them how long, when do you want me to follow up? When do you want me to come back? If they say, oh no, you're fine, you don't need to come back. No, you do. I do need to come back. I want you to make sure that the medication is working. Older people again can feel sleepy, confused, dizzy, or unsteady with certain medications. Always, always, always report any feelings that are different to what you normally feel to your doctor. Your doctor will determine if there needs to be anything done about it, or they can take a look again at your prescription list and decide if they need to address it or not. But always report it. Don't think that it's a thing of nothing, because it could end up being something major. Older adults again, dizziness, unsteady, they're more likely to fall, and we talked about falls. As I said, falls can be detrimental. Nobody wants to fall, but if older people fall, remember you have older bones, they can, fracture. A hip fracture is the most common. And just another little bit about side effects and medication. So side effects can be misinterpreted. It can be, is it a side effect or is it a other condition emerging? Or is it a drug interaction? If there's two medications interacting with one another and you get a side effect, is it really a side effect, or are they misinterpreting as another condition? And medication again for that condition, what looks like a condition, but isn't a condition. One I have up here, one of the most common ones is starting anti-Parkinson therapy, medications for Parkinson's. Any symptoms arising from the use of drugs such as antipsychotics or drugs that are given to people with schizophrenia, bipolar, depression, major depression, they may be on antipsychotic drugs. The other one is metoclopramide. That is actually that's the generic name. The trade name is Reglan. It's a drug that's given to it for upset stomach. So you're taking Reglan and your side effect could be Parkinson's. Look, if I look like Parkinson's, doesn't mean you have Parkinson's. It could be a side effect of the medication. The terminology is prescribing cascade, which you don't need to know. So it can lead to other symptoms as well, like orthostatic hypertension and confusion. Confusion can be misinterpreted too. And maybe medication can be given for that, but it's not, it's all a side effect of your medication. Since the accountable care since Obamacare came into play, most of the population are talking about it around insurance. One of the other things with Obamacare was prevention, screening, individuals taking ownership for their health, individuals taking ownership for their lifestyle, their healthy lifestyle, so that you have less problems going down the road. And this is true for everybody. It's all, and when you go to the doctor, and especially around medication, you need to ask questions. I think some older people, they could go to the doctor, they could be there for 30 minutes, 45 minutes, discussing all kinds of things about their health, about their family. Those days have gone. You now go to your primary care doctor, you probably get maximum 15 minutes. They're under pressure. They have so many people coming into the office and they have to see everyone. You don't want any primary care doctor coming out to the waiting room and saying, oh, I'm sorry, I spent 45 minutes with these people and I'm not going to be able to see you today. So they have high lists of patients and they don't have a huge amount of time to spend with patients like they used to have in the past. So it's important that you know the questions to ask while you're in the doctor's office. And that's all part of protecting yourself. So I do have a handout down here, so you don't really need to remember this, okay? I have a handout there that you can keep a list of all your medications. Include the brand and the generic name. The dose that you take, whether you take 5 milligrams or 5 mils or whatever dose you're on. The frequency that you take it, are you taking it 3 times a day? You're taking it 4 times a day, or are you only taking it at bedtime? That's your frequency. The route you're taking it, is it under your tongue? Are you taking it as a pill or a tablet? Are you taking it as something that you rub on your skin? Is it a patch? Or is it a suppository? That's the route. And then your reason for taking it, you should know the reason that you're taking the medication. Is it for your blood pressure? Is it for your kidneys? Is it for your diabetes? Is it for your skin? What reason do you have for taking it? And the name of the doctor or the nurse practitioner that prescribed it. You need to have a list of all of those things. Questions to ask your doctor. These questions you need to ask your doctor every time you're prescribed a new medication, or if you have a medication and you're really not sure how you're taking it. So, why am I taking this medicine? What are the common problems to watch out for? Things that you can expect to happen. Within side effects, you have side effects, regular side effects, but then you can have more serious side effects as well. The serious ones are the ones that you really need to watch out for, but any side effects should be reported to your primary care doctor. What should I do if I have problems? When should I stop this medicine? Can I take this medicine with other medicines that are on my list? Because you brought your list and you brought your medications to the doctor's office. What will happen if I don't take the medicine? All those questions, and there is a handout for that as well. You don't need to remember them. This is an example of what's written on your bottle. This is what you have on all of your prescription bottles. The pharmacy, the doctor who wrote the prescription, the date the prescription was filled, the phone number of the pharmacy. This number here identifies your medicine for refills, who the medication is for, the way you should take the medication, 1 capsule by mouth 3 times a day. Okay, it's written out very clearly. It's not written in like medical sort of jargon. Each dose about 8 hours apart. Okay, so you're not going to take it 4 hours apart or 6 hours apart. It will tell you the space you need between each dose. For 10 days until you've taken it all, this is an antibiotic. Awesome. Finish your antibiotic, it doesn't matter how you feel. Finish your antibiotic always. Don't stop at day 7 or day 5 if you're on a 10-day dose, just because you feel better. Always take your medication on time. You know, take the full antibiotic, or antibiotics especially. I don't think there's anybody here today, and this really isn't for older people, but if you're a younger person, remember, your antibiotic and your contraceptive pill may not work together. Your antibiotic will work, but your contraceptive pill could fail. The doctor's authorization, and use it before 7/14/14. And that is, you can see this was dated as an antibiotic 1/17/14, and then you have 7/14/14. It's just the time frame that the medication can be filled. The generic name of the medicine, safety reminders, finish all this medication unless otherwise directed by the prescriber, and that's going to be on, that's safety. That's what any safety messages will be on the bottom. The expiration date of the medicine, that's what that all used before. So there is an expiration date, and every medication has an expiration date, especially these antibiotics. Dose and strength of the medication. So all that's on the bottle. So don't just take your medication bottle and take whatever is inside of it and then just pop it in and not look at the bottle. When you pick up a new prescription, ask your pharmacist. Your pharmacist is the most knowledgeable person about medication. Your doctor is not the most knowledgeable, your pharmacist is. Ask your pharmacist if there are foods, supplements, or other medicines that you should avoid while taking your medication. Okay? One of the ones that comes to mind is grapefruit juice. Grapefruit and grapefruit juice. Grapefruit interacts in the small intestine. It blocks an enzyme that's needed for the absorption of your medication. If your medication isn't absorbed into your bloodstream in the intestine, it's not going to work. There is a small amount absorbed, but the grapefruit will block the enzyme that's needed to absorb it. Your pharmacist, again, is a great resource. Ask them questions that you might have about all of your medicines. Keep your medicines in the original containers and read the instructions that come with them. I do want to say something. I was at my own doctor quite recently, and I told him I thought I had a little bit of indigestion. Oh, okay, I'll give you Prevacid for that. He didn't ask me when I had it. He didn't ask me how often I get it. I said, no, I knew I didn't want that. So I said, no, if I don't have a glass of wine in the evening, I won't get the indigestion. So that's easily fixed. I don't need to be on another medication. Most older people don't know to say that. They will take the medication and then that's added to the list. He didn't even know. He wasn't even telling me what Prevacid would do. He didn't explain any of it. He was just ready to write the prescription. Now, I'm not blaming the doctor because I know they're under a lot of pressure to see all their patients and they don't always have time. But on your way out, you can stop your nurse and you can ask your nurse. If your doctor doesn't answer the questions that you need him to answer, him or her to answer, ask your nurse before you leave the office. A little bit about generic and brand. So all prescription medications have at least two names. They have two names. They have a generic name and a brand name. The generic name of the medicine is the active medical, the chemical ingredient that's in it. That's the generic name. They're almost always harder to say. The brand name is easier to pronounce. The brand name of the medicine is given by the drug maker. The manufacturer of that medication gives it the brand name. So a new medication comes out. Research has gone into it. All the research that they do for, I don't know all the research, I just know they do a lot of it. But they do a lot of research, and then they have testing, and they have sample sizes, and they test it on some patients. There's an awful lot of work in the background that goes into it before it hits the market. The FDA go through more, they check everything. It hits the market, and it would be expensive for at least the first 5 years. And that's to recoup the money back that was spent on all of the research. There will not be a generic of that medication out for some time once it hits the market and it's released. Generic medicines are copies of brand name medicine. They're usually less expensive, and they have the same active ingredient as the brand name. There is no difference. The only difference is after that time frame, say 5 to 7 years, and it could be more for more other medications. I don't know the exact number of years. So let's say in Pfizer, they're selling a medication, 7 years later it's released. Okay? It's released of the restriction. So then Squibb or one of the other manufacturers make that same medication. They cannot call it the brand name. They're not allowed to call it by the brand name. They have to use a generic name. And that's that name that you see that you can't pronounce. Usually the brand name is the easier one to pronounce. But the brand name drug is always more expensive than the generic name. And the reason is recouping that money that they spent. It may drop a little bit in price after 7 or 10 years, but not really significantly. The generic medication is the one that can be used. A lot of the newer drugs that are coming out, brand name drugs that are coming out today, they're not going to have generic names for a few years. And we covered that. The brand name has patents, and we understand patents. So it doesn't mean that the generic name is any less of a medicine, nor does it mean that the generic name hasn't gone through the restrictions and not restrictions, regulations that are in play from the FDA. They still have to produce their drug to the FDA, who will investigate it and make sure that it's okay for that manufacturer, that it's a safe medication, as safe as they can be, to release it onto the market under the generic name. These are the differences we talked a little bit about in generic names. They might be a different shape, color, the pill itself, the tablet, pill, or capsule might look different. They do cost less. They follow the same government rules about strength, quality, purity as the makers of brand name medicine, and it's the FDA that regulate that. They require careful testing. We talked about that. As careful as the brand name companies, as they require from them. Recently, we had COVID, as you know, the whole world had it, and the pharmaceutical companies looked for emergency use. They petitioned the FDA for emergency use. I know here in this country, we have the Pfizer vaccine and the Moderna vaccine. We didn't have the AstraZeneca vaccine, which is the one they had in Europe predominantly. And the reason for that was that AstraZeneca didn't petition the FDA for emergency use. So that's why, even with people coming into the country, there was some talk that maybe the AstraZeneca vaccine wouldn't be recognized as a vaccine. So if they didn't petition the FDA, they didn't give them any paperwork, they didn't give them any research on it, they didn't give them any information. So the FDA, for that reason, could not say, yes, this is an effective vaccine. And that's why I know there was some question around AstraZeneca. Pfizer and Moderna, the two manufacturers that we did have, the FDA did do their due diligence before it was released onto the market. And I think if you remember, the vaccine was there and we were waiting a couple of weeks. And then one Friday, it was announced the FDA approved. But it was emergency use, which is a method of getting something out for safety of the population. So it's not that the due diligence was not done by the manufacturers, it was. It's just, there was a rush because people were dying. So there's going to be a rush, but the FDA did do their due diligence for looking into the vaccine. Do you have any questions? Anybody? The other side to all of this, apart from medications, is, I'm sure your doctors have told you this, lifestyle changes. Lifestyle has a huge impact. Diet and exercise. What you're eating is affected. What we eat is affecting us. It affects older people, it affects younger people, it affects everybody. Exercise, this varies with 10,000 steps a day. I think exercise, especially for older people, to do it on time, rather than looking at all those steps. I mean, 10,000 steps a day, you'd be running around the block all day long. I mean, you'd be up and down the road, so and even if you're at the gym, how long would you be at the gym to get 10,000 steps done? You'd be there half the day. So if you do it on time, like, okay, I'll walk for 3 minutes today. I'll walk 5 minutes next week. I'll walk 10 minutes the week after. And walking is the best exercise. It's not going to do your joints in. You're not going to have any knee problems. You know, wear good walking shoes. All of that, like your diabetics, exercise has an impact on their sugar levels. Exercise will bring your sugar down. Diet will bring your sugar down. Carbohydrate is the big thing with diabetes. Yeah.
Fiber also extends carbohydrates.
It can do, but you're actually better off having a low to no carbohydrate diet. You know, if you're watching calories, you're watching fiber, you're wondering if you've had enough of this, enough of that, just think low carbohydrate. No rice, no potatoes. That's my big thing. Potatoes with not just a bit of an olive butter, chunks of butter. What other ones are carbs? There's carbs in everything, carbs in all the processed foods. I listened to a podcast recently that talked about carbohydrates. And of course, alcohol has carbohydrate. We talked about drinking water. So we drink water, and eventually your body will tell you. So if its triggers go to your brain, eventually your body will say, you've had enough water. You don't need to drink any more water. But if you drink alcohol, there's no trigger to tell you to stop drinking. Passing out is toxicity. It's not a trigger, okay? there's no trigger up here, so it isn't an essential nutrient. Not like protein or fats or, you have the carbohydrate, you just have to minimize it, especially if you're diabetic, or really for everybody, because type 2 diabetes is becoming a real thing. We hardly ever heard of it in years gone by. It was always type 1 diabetes. They're not related. They come from different origins. It's not just because you have type 2 diabetes doesn't mean that you have to get injections of insulin. What it does mean is you have to lower your carbohydrate intake significantly. And increase your protein intake. So I think thinking about carbohydrates, and I'm talking purely from a personal level. I could have my dinner, I could sit down, I might have one ice cream. Half an hour later, I might have another one. I open a bag of chips. If I open a bag of potato, I'm likely to have 3 bags. I mean, I just can't stop with one. So, oh yeah, into my face. Then it's like, then I'm bloated, but I could still go for another ice cream. There's no real trigger up there to stop you eating carbohydrates. So you have to wonder how essential it is for us to have carbohydrates. Sometimes you just can't avoid it. It's in sauces, it's in different things, but it's definitely worth noting to lifestyle, diet and exercise. If you're on medication, your lifestyle changes, not for a week or a month or, I'm talking about lifetime changes, okay? So you're going to change how you eat from now on, not just change how you eat until I get into a dress, that can reduce the medications you're on. It may not take you off a medication, but it can reduce the dose. And remember, if you're reducing the dose, you're reducing the risk of various side effects. Okay. Any questions? Over here on the table, there is those handouts, the questions to ask the doctor.